Ladies and gentlemen, dear colleagues, media representatives, it is my great pleasure and honor to welcome you on behalf of the faculty and to wish you successful work of this conference. I'm especially pleased to welcome Dr. John Nelson and his team, whose research is helping to improve the working condition of healthcare workers and improve health outcomes and satisfaction of our patients. This important international conference will feature the latest findings from this global research project involving 21 countries. Representatives from 11 countries from North and South America, Asia, and Europe are attending this conference. Some of them are online. The Caring Science International Collaborative is currently the only global research project focusing on the well-being and job satisfaction of nurses in the workplace. Their research on the healthcare environment is the most comprehensive analysis of nursing job satisfaction in the world, which is used to improve working condition, working organization, and employee satisfaction, as well as to improve the quality of care and optimize healthcare system organization. As a member of this project, Faculty of Health Science, University of Rijeka, in collaboration with Clinical Hospital Center of Rijeka, the Health Center of Primary Gorski Kotar County, and the Croatian Chamber of Nurses, has been contributing the promotion of this important research since 2020. The application of the results and guidelines derived from this research ensures an improvement in the quality of care, better treatment outcomes, a reduction in healthcare costs, and higher satisfaction of nurses in practice. So at the beginning, I invite Professor Malnar, Dean of our faculty, to address conference. Please.
Dear colleagues, it is a great honor to greet you and welcome you to our beautiful country, our city, and our faculty. I'm so proud that our faculty of Health Studies of University of Rijeka is hosting this international conference where we will have the opportunity to hear the latest results of global research project in which 21 countries are participating. The Caring Science International Collaborative is currently the only global research project studying the well-being and job satisfaction of nurses and technicians in their workplace. Nurses, not only in Croatia, but also more widely, are exposed to great stress at work due to administrative burden and the lack of staff, which results in an increased workload. All about the results, not only in dissatisfaction, but also in great fatigue and stress in everyday life, which certainly affect the quality of life. Therefore, the results of this research will contribute to the improvement of working conditions, the organization of work, but also to an increase in employee satisfaction, which will hopefully result in an increase in quality of health care. I would like to thank Dr. John Nelson for allowing us and inviting us to be a part of this great research. Our faculty, in cooperation with Clinical Hospital, the Health Center of Primorsko-Goranska Country, and the Croatian Chamber of Nurses, gave its research contribution to this project. I would like to thank the city that supported us in organizing this Congress. Thanks also to everyone who was involved in the organization of the meeting. I have no doubt that they did a good job. I hope that the weather will serve us well and that you will enjoy the quality lectures at the Congress and get to know our city and the gastronomy of our region, and that you will return home full of positive experience and beautiful memories. And finally, allow me to once again thank John with small present. Okay. Thank you. Thank you, John. And we have some present for Domenica, because Domenica has been part of our faculty family from a long time. Domenica, please.
These project partners are very, very important. The most important partner is also clinical hospital center. So I invite Morana Magaš to address conference on behalf of clinical hospital center Rijeka.
Distinguished guests, esteemed colleagues, and respected participants. On the behalf of Director of Nursing Clinical Hospital Center Rijeka, I'm honored to welcome you all to this prestigious scientific meeting dedicated to advancing the field of nursing. It is indeed a privilege to stand before such a gathering of accomplished professionals, researchers, and experts in the realm of nursing. As we all embark on this journey of knowledge exchange and collaborative exploration, we recognize the critical role that each one of you plays in shaping the future of nursing. The challenges we face in ever-evolving healthcare require innovative solutions, evidence-based practice, and shared commitment to excellence in patient care. Over the course of this conference, we will have the opportunity to delve into the latest advancements in nursing science, share valuable insights, and engage in fruitful discussions. The knowledge and experiences shared here will contribute to the improvement of patient outcomes and overall quality of care. I encourage you all to actively participate, connect with your peers, and seize this occasion to learn, inspire, and innovate. Let us harness the collective power of our expertise and dedication to drive positive changes in the healthcare sector. Once again, welcome to this esteemed gathering, and I wish us all a productive, enlightening, and enriching conference ahead. Thank you.
Thank you, Morana. Dr. John Nelson founded healthcare environment with passion and vision to improve the work environment for nurses, clinicians, and patients based on true science. Dr. Nelson is founder and president of the Caring Science International Collaborative, and his expertise and predictive modeling informs operation leaders of the relevant factors to address which will improve staff well-being, promote retention, and improve patient outcomes. His book, Using Predictive Analytics to Improve Healthcare Outcomes, is the 2021 winner of the American Journal of Nursing. So, John, floor is yours.
Well, thank you very much. It's really an honor to be up here presenting to all of you and to be collaborating with you in this international work. What I'd like to do is just give you a little background for the collaborative, where it's, we are today. But before I talk about that, I want to first thank our hosts here in Rijeka. You guys have been just absolutely fabulous. And Maria Stefan, she has been absolutely tremendous, and her team has been so wonderful. So we just thank you so much for your hospitality, for your professionalism, and for just putting on this really wonderful meeting together. So thank you so much for this. So I would like to just give you a little background that when I present the research in about an hour or so, I think you'll find it very interesting that we will compare the 9 countries that are have collected data so far. We have Japan is still collecting data, Colombia is still collecting data, so we have more to do. But right now, I just want to give you a little background of how we ended up here in Rijeka, Croatia. It was in I was a staff nurse. I worked as a staff nurse for 11 years. And the hospital I was working at, they were going to change the format of nursing from a primary nurse format to a team nursing format. So instead of having the same patient from admission to discharge, it was going to be more function oriented. So nurses would be more task oriented. Well, this was very frustrating to me. And so I went to the literature to see what kind of evidence I could find to support primary nursing. Well, I didn't find any research on primary nursing. So I called the leaders that were in primary nursing and I asked them, do you have some information? Well, they didn't. So then I decided, well, I'm going to see if I can collect some data on primary nursing and see if I can make a defense why we should do this. And so I went and took a statistics course, and I didn't like statistics. And I'm a mathematician now. I mean, obviously, I've learned to like mathematics. I love mathematics. But when I went and took this first class, we were all given just a little bag of peanut M&Ms. And this story is in the book, Using Predictive Analytics, because this was a life-changing moment. Who knew that a bag of M&Ms would change my life? But the professor teaching statistics, we all took out our bag of M&Ms and we lined up the blue, the yellow, the red, all the different colors. And so then all of the students described what they saw in front of them. And I thought, well, this is kind of interesting. So we described our M&Ms and, you know, all the different, descriptions. And it hit me. So now if I can describe a bag of M&Ms, can I describe different units of nurses? Can I use this mathematics to tell not only a story about M&Ms, but can I tell a story of nursing? So I asked my professor, can I use mathematics to tell other stories? And I had no idea that this was going to open up a world of mathematics and a passion for mathematics for me. And she said, well, you can use math for anything. You can measure anything. And I thought, well, that's what I'm going to try to do. So I got my master's degree in statistics. And then as I was getting my PhD, I was learning how to measure job satisfaction. And the theory that I utilized is social technical systems theories. I thought, it's not the manager's job to make me satisfied. As a professional nurse, I need to pursue what I need to be a professional. And I need both social and technical resources to do the job. So I developed an instrument in my master's and PhD because my master's degree was in statistics. So I had to do something that was more like a PhD. And so after I developed this instrument of job satisfaction, and it was a 76-item instrument that together we ended up reducing to 19. But then I had someone call me that was working with Dr. Jean Watson. She's a caring theorist. And they said, can you measure caring? And I said, well, you can measure anything. And so I ended up doing about 75 different studies in the concept of caring. And I wrote a book on measuring caring. And Jean Watson and I, Dr. Watson and I, we were the co-editors of that. But in that time, my friend and colleague, Jane Felgen, when we did a lot of discussion about job satisfaction and caring, she said, John, I have a question for you. And this was the birth of CSIC. We were in a parking lot after dinner and she with a bunch of colleagues and she said, John, I want to know, can we measure everything? And I said, well, if you think you can, you're more likely to measure everything. And if you think you can't, you probably won't. And she said, well, I want to measure everything in healthcare. And I said, all right, let's go. And so we started a conversation about how do we measure the practice of nursing that includes professional practice like primary nursing, like their relationships, like their caring for patients, like their caring manager. And 20 years later, here we are, trying to measure everything. But we are measuring what I feel is most important as far as it relates to outcomes. In healthcare, we study patient variables, we study system variables, but we don't look at how is the well-being of the staff impacting the patient's outcomes? How is it impacting cost? And so collaboratively, the Caring Science International Collaborative, it used to be called Caring International Research Collaborative, but that was another life of this research group. And now we are focusing solely on well-being, and the instrument that I will describe to you will show you how we are able to explain 77% of what makes up well-being for healthcare workers, specifically nurses. And we look at caring of self. We look at caring of the manager, super important. We look at clarity of role and system, and we look at job satisfaction, specifically 3 social variables and 3 technical variables. The social variables we look at is caring of the coworker. Am I satisfied and do I have good relationships? We look at communication with the manager, called participative management. Do I have good communication with my manager? And finally, for socially, do I have a good relationship with my patient? That's primary nursing. And so full circle, I am ending up developing, we are developing literature that will show the impact of a primary nurse. The technical variables we look at, am I satisfied with my level of autonomy? Am I satisfied with my professional growth? Very, very important post-COVID. And am I satisfied with my organizational rewards? We reduced it from 97 items to 35 items, and I will describe that in more detail in the research presentation in the virtual session. But we are really excited to be able to have an instrument that is precise. That's very important for reducing error, and to be able to connect to outcomes so that we can show the well-being of our staff does impact our outcomes. So we're real excited to move it not only into the mathematical and predictive analytics, but then eventually into IT. And we'll be talking more about that. Dr. Kathy Schwartz will be talking more about that. Now, the Measuring Caring book that I wrote with Dr. Watson and 81 contributors from 11 countries. That was the first international work we did, and that was with the Caring International Research Collaborative. And then our book on predictive analytics, that is because of all the work here. And so we look at how do we predict outcomes like central line infections, length of stay, patient falls, etc. Now, another wonderful colleague in our collaborative is our colleagues from Scotland. I've worked with them for about 10 years. We have done 4 large studies, so we're able to study longitudinally what is the impact of implementing a professional practice model. They call it the Caring Behaviors Assurance System, and they will be giving a better, more detailed review of their research and operations tomorrow. The important part about this collaborative is it isn't just academicians and researchers, it is also operations. Why do research if you're not going to improve practice? But we also have staff nurses. Without the staff nurse, we could not do all this. It has to be the frontline workers that understand the story of outcomes. And so we'll talk about how we transform their story into measurement models, into improving outcomes and predicting those outcomes. The last partner, I will say, that we work with is business. Now, what is interesting about business is we go to a company because they're experts. We bring them in and have them give us a proposal, and then we get suspicious of them because they are going to charge us to do this. So then we send them away, and then we do our own thing, and we aren't the experts because we've just sent them away. So what we have done is we are meeting with different business partners. We call them content expert partners, and we've asked them. We know we have a need to charge. So let's just get that out of the way. We know that that's coming. But we need your expertise so you can work with us so that we can act focusing, as well as some you'll be hearing from a caring leadership consulting group. But it's important that they help us understand that construct. Caring, super important. Staffing and scheduling, super important. Training, like nurse residency. We haven't gotten a nurse residency company yet. But those partners are critical for us to not only negotiate a price that is workable for us, but that we can at least utilize some level of their expertise. So these are the different partners that we're utilizing in the Caring Science International Collaborative. So that's how it came to be and how we have formed now to work together with 21 countries. We've had 15 countries that have measured. This year we had 10. Last year, the 2019 to 2021, we had 11 countries. And I'll review that in more detail. Now, I did want to review with you some of the sort of the agenda for the next few days, so we sort of know what's coming. For those of you that are online, we do have documents that you're welcome to request, and we would provide those to you. But the first document I want to share with you is that we do have something called the Collaborative Plan and Strategy. That's in your should be in your folder. If you don't have a document, we're happy to share with you. This shows you the plan and strategy that we are outlining over the next several years. The Caring Science International Collaborative, which we call CSIC, it has grown to a point now where we really need to get more of these formal processes and documents in place, but this will give you a nice idea of where you might be able to jump on and get involved. The other next document I wanted to review with you is the 2024 to 2025 research protocol. Now, as we've been talking amongst ourselves, we had a conversation this morning with Poland and our Japan colleagues and Slovenia and the US. Those 4 countries were sitting around having coffee, and we were talking about the different stages that different people are in. Some are, like Scotland, are much farther along. Some are wanting to do predictive analytics and actually forecast retention. But then there's others that are at the point where they are simply wanting to study well-being, because that's where they'd like to start and understand how that instrument works. Our profile of caring, that is only 35 items, is in 15 languages. We use back translation, where I send the 35-item survey to the country of interest. They translate it into their language. A second translator translates it from their language to English. And then once it's translated back into English, they send it back to me. And then I will say if it's still reflective of what the original questions were supposed to be. That's called back translation. We do have an international ethics review board. Every country and every facility is required to have ethics review. We call it internal review board in the United States, but most countries call it an ethics review committee. We have an international ethics review committee in Minnesota, and once the facilities and the countries have their ethics review approved, they send it to me, and then I have an international review board, make sure that there's a standardization across the entire globe. But this document shows you that there's different levels that we are inviting people to be involved. Now, this next and last document is the save the date. Now, this has been a fantastic meeting. We're so impressed with your hospitality, your facilities, all the professionals. Next year, it will be in Adelaide, Australia. We have, and they are, it's the chief nurse officer over the entire Southern Australia area. And they're very interested in getting involved with us more deeply, but they asked if they could host the next conference. So the next meeting will be October 15th through 17th, 2024. So save the date. And we would love to have you in that. So that is the overview of what our, and I should say too. So after we have our coffee break, we will then hear from our Japanese colleagues and our Polish colleagues. They're going to be presenting the research that they examined. And then I will take about a half an hour and I will present the overall study. We will compare all the countries that we have participated this year. We have about 2,042 complete surveys. I think it was 2,076 that actually responded to the survey, but just 2,042, I think that's what it was, that completed all 35 items that are in the analysis. So I'll review that. And then tomorrow, we will have Scotland take a half an hour and review, no, it's an hour, I think, an hour. And you're thinking, oh my gosh, that's so short, we have so much to say. So anyway, so that our Scottish colleagues will be presenting tomorrow, and then our Croatian, we will have a presentation from Maria. And then the remainder of the day, we will be doing a World Cafe and discussion. So we will do it in small groups, and that's led by Jane Belgium. So we're real excited to be able to talk about the data after we've heard all the presentations. And then on Thursday, we have a scientific panel that we will have several people that are involved with this research, and we will just talk about CSIC, but different people with their review of what it's been like to participate in CSIC. So again, thank you for your time, and it's just an honor to be here and to continue the collaboration and the deepening of the research in the profile of care. So thank you.